What if your heart gave you a quiet warning? Not a dramatic collapse, but a wave of exhaustion, a skipped breath, a strange ache in your jaw, and you were home, alone. Every 40 seconds, someone in the U.S. has a heart attack. And for seniors, over 65% of fatal heart attacks happen before reaching a hospital. But here's the good news. Knowing how to avoid a heart attack at home and having a proven action plan could literally save your life. Let's talk survival. Let's talk prevention. Let's make sure you're ready, starting today. You don't need to be a doctor to save your own life. You just need a plan. For millions of seniors across America, the idea of experiencing a heart attack or stroke alone is terrifying. But what's even scarier? Most people don't realize it's happening until it's too late. The classic movie-style heart attack, someone gasping, clutching their chest, happens less often than you think, especially in adults over 60. The real warning signs are subtle: fatigue, shortness of breath, nausea, confusion, jaw pain, sleep trouble. And they're often ignored. The truth? You can prevent a heart attack at home. You can reduce your risk of stroke. You can survive even if you're alone, but only if you know exactly what to do. In this guide, I'll walk you through a proven step-by-step emergency plan tailored for seniors. You'll learn how to avoid a heart attack before it starts, what to do in the first 3 minutes of symptoms, the best myocardial infarction drug treatments to keep nearby, and how to prevent heart disease with everyday habits. You don't need to feel powerless anymore. Let's take back control, starting with your heart. Part 1. Recognizing risk and early symptoms. Most heart attacks don't start with a bang. They whisper. And for seniors, especially those over 60, the warning signs are often silent killers. Understanding them is your first defense in learning how to prevent the heart attack before it strikes. Alert: the silent signs you should never ignore. Let's start with the most commonly overlooked symptoms. Unusual fatigue, the kind that feels different from your normal tiredness. Shortness of breath, even while resting or doing light activities. Nausea or indigestion, often mistaken for food poisoning or reflux. Jaw, neck, back, or shoulder pain. Lightheadedness or sudden confusion. Sleep disturbance or insomnia. Cold sweats or clammy skin. These symptoms can occur days, even weeks, before a full-blown heart attack. And they don't always appear together. You might only have one or two, but even one could be a red flag. Doctor: women and seniors, different symptoms, same risk. Many seniors assume that a heart attack means chest pain. But according to the American Heart Association, women over 60 are more likely to experience non-classic symptoms like fatigue, nausea, or anxiety. This makes it harder to recognize what's happening, and why heart attacks in women often go undiagnosed until it's too late. Men, on the other hand, are more likely to feel chest tightness or arm discomfort, but even they can miss the signs if they're subtle. If you live with diabetes, high blood pressure, or have a family history of stroke or heart disease, your risk increases, and symptoms may be even less noticeable. Warning: don't confuse stroke with heart attack. While strokes and heart attacks both involved blocked blood flow, they affect different organs. But early symptoms like confusion, dizziness, and nausea can overlap. If you're unsure whether you're having a stroke or a heart attack, call 911 immediately. Time is critical for both. Remember, recognizing the warning signs early is the first step to avoiding a heart attack and possibly saving your life. Part 2. Emergency Response. 7 Proven Steps to Survive at Home. So you've recognized the symptoms. Now what? These 7 steps are simple, proven, and potentially life-saving, especially if you're home alone. Print them, memorize them, practice them, because in a heart attack, seconds matter more than anything. Step 1. Stop and sit. Do not brush it off. The moment you feel anything suspicious, unusual fatigue, pressure in the jaw, sudden breathlessness, stop what you are doing immediately. Sit down in a supported position. Why this matters? Movement increases the heart's workload. Sitting conserves energy and helps you stay conscious longer. Many seniors delay action thinking it's probably nothing. That delay kills. Step 2. Call 911, not your family. Your instinct might be to call your spouse, daughter, or neighbor. Don't. Call 911 first. When you say, "I'm a senior having possible heart attack symptoms," your call is prioritized. Why not drive yourself? You might lose consciousness mid-drive. Paramedics begin treatment immediately, even before reaching the hospital. They can assess if it's a stroke, heart attack, or something else. This is how to avoid a heart attack becoming fatal, by getting help fast. Step 3. Chew the right aspirin, not swallow. If you're not allergic and haven't been told to avoid aspirin, take 325 milligrams of uncoated aspirin, 1 adult tablet or 4 baby aspirins. Chew thoroughly, don't swallow whole. Use just a sip of water. Why this matters? Chewing gets the drug into your bloodstream within 5 minutes. Swallowing can take 30 minutes, a lifetime during myocardial infarction. Tell paramedics what time and dosage you took. This is one of the most effective myocardial infarction drug treatments available at home. Step 4. Position your body for survival. Your body position can hurt or help your chances. If you're short of breath, sit upright with your back supported, high Fowler's position. If you feel dizzy, recline at a 45-degree angle to keep blood flowing to your brain. Feeling nauseous, sit up and lean slightly to your left side to avoid choking. Also, loosen tight clothing, neck, chest, and waist. Cover yourself with a light blanket if cold. Shivering increases heart strain. Stay calm, stay still, don't walk around. Your job now is to stay stable until help arrives. Step 5. Control breathing. Use the 4-7-8 breathing technique. Heart attacks cause panic. Panic makes everything worse. The 4-7-8 breathing technique helps calm your body and protect your heart. How to do it? Inhale through your nose for 4 seconds. Hold for 7 seconds. Exhale slowly through your mouth for 8 seconds. Repeat at least 4 times. This activates your parasympathetic nervous system. It slows heart rate, lowers blood pressure, and improves oxygen flow, all critical in a cardiac event. This technique also reduces anxiety, which helps you think clearly and communicate better with EMS. Step 6. Activate your medical alert device, if available. If you wear a medical alert necklace, smartwatch, or emergency button, use it now. These systems connect you to trained dispatchers. Some devices auto-call for help if you lose consciousness, fall detection. Many link to your emergency medical profile. This is especially useful if you're unable to speak or pass out before calling 911. For seniors living alone, medical alert systems are a vital layer of protection. Step 7. Unlock your front door and prepare for EMS. If you can walk a few steps without strain, unlock your front door. This ensures paramedics can reach you if you pass out. Also, put your medication list and emergency contacts on the fridge or kitchen wall. Keep a copy in your wallet or phone. Program emergency contacts in your phone with the label ICE in case of emergency. Bonus tip: tell neighbors how to find your house at night. Put visible reflective numbers outside. Part 3. Build your heart attack survival plan. You've learned what to do during a heart attack. But what if you could make everything easier by preparing before it ever happens? That's exactly what a heart attack survival plan does. It's how to prevent the heart attack from becoming fatal, even if you're home alone. Let's build yours now. Step 1. Create a medical emergency card. List the following on a single sheet of paper: full name, age, address. Allergies, chronic conditions like diabetes, high blood pressure. Current medications. Emergency contacts like family or neighbor. Your doctor's name and phone number. Place this in 3 spots: on your fridge, in your wallet, and near your bedside. This helps first responders act faster and smarter. Step 2. Store aspirin in smart places. We've discussed the role of aspirin in myocardial infarction drug treatment. Now, where should you keep it? Place uncoated aspirin in your nightstand, kitchen drawer, your purse or wallet, or car glove box. Use a labeled container. Seconds count. Step 3. Set up emergency contact info on your phone. Add ICE in case of emergency before key contact names. Use smartphone medical ID features. Set lock screen info visible for EMTs. These small steps save precious time if you can't speak. Step 4. Consider a medical alert system. If you live alone, this is not optional. Choose a wearable with 24/7 response, fall detection, location sharing. Many seniors think, "I'll never need it," but when you do, it's too late to wish you had one. Step 5. Make your home emergency ready. Reflective house number visible from the street. Night lights in hallways. Phone near bed and living room. Checklist on the fridge. What to do if I feel heart symptoms. Walk through your response plan every few months. Practice makes it automatic. Final tip: share your plan. Let a neighbor, friend, or family member know where your emergency info is, what your symptoms usually are, and what you want them to do if you can't respond. A survival plan isn't just about information. It's about making sure the right action happens instantly. Part 4. You now have the tools to survive a heart attack, and even more importantly, to avoid one. Let's review the 7 life-saving steps. Stop and sit the moment symptoms appear. Call 911, not a family member. Chew uncoated aspirin immediately. Position your body to reduce heart strain. Control your breathing with the 4-7-8 method. Activate your medical alert device. Unlock your door and prepare for EMS. These actions may seem small, but they can literally mean the difference between life and death. Just like we teach fire drills to children, seniors must practice heart drills, because heart attacks are far more common and far more silent. Don't wait until your heart forces you to act. Be ready before it does. And remember, avoiding a heart attack doesn't just mean reacting, it means preparing. That's how you prevent heart disease, reduce stroke risk, and protect your independence.